Hello, my name is Dr. Danae Eby. I'm a physical therapist at Belair Physical Therapy. This time we're going to talk about the sacroiliac joint and the slings to help stabilize it. So there are a couple of different slings, so we're going to go over here. So the first sling, my favorite, is the posterior sling. It's where the lats, these muscles right here, connect with this fascia over to the glutes over here. The reason why these slings are so important is because there's no muscle that actually connects to the sacroiliac joint, which is right here. So this is your sacrum bone and this is your iliac bone. So it connects at the sacroiliac joint, and sometimes you can have like a lot of pain right in here, and that's because it's either moving too much, not moving enough. So it's either hypermobile, moving too much, or hypomobile, not moving enough, or it's just not moving appropriately. So it could be all those three things. So since there's no muscle that directly connects to it, we have to work on the slings to help stabilize it in its place. So like I said, the lats and the glutes kind of create an X to help stabilize it during the joint, while the joint moves and as you move. So, and on a real person, it's right in this area. So if you have pain here, you may have sacroiliac joint. So we're going to go over a few exercises, but remember these are just general recommendations. So if you want something more specific, or if any of these exercises have pain, just send us a message, give us a call, and we can maybe set up either a virtual visit throughout all this coronavirus COVID-19 stuff, or hopefully get up an evaluation so we can help you out with that. Okay, so posterior sling, lats and glutes together to help stabilize the sacroiliac joint right in here. So let's go over an exercise for that. So we want to contract them together. So what I like to do is lunges with a lat pull down. So I'm going to work on my right glute and my left lat. So I'm going to start out in a little lunge position, a backward lunge. My core is tight, hips are forward, back is not either arched too much and not curled too much. It's right here in the center. So as I'm keeping my back and core tight, weight is in the heel. I'm going to face forward and I'm going to pull down with my left arm down and back in this position to activate my lats. So now I feel it in my glute, I feel it in my lats, and that is how you can activate the posterior sling. You can do this about 5 to 10 second holds, do it about 3 sets of 10, or whatever you can do. Don't forget to do the other side though, because you have two sacroiliac joints in the right position, core's tight, hips forward, weight in the heel, pull it on back, just as so. I like to hold it for a little bit just to make my muscles work a little more. There we go. So that's the first one, that's the first sling. Second sling, over here, we're going to go over the anterior oblique sling. So the external oblique right here kind of joins in with the internal oblique on the other side, and it covers the front and joins in with the adductor muscles, which are the muscles on the inside of your legs. So in the front, it also creates a cross to help stabilize the sacroiliac joint back here by stabilizing the front part. So let's go over an exercise for that. All right, so you can have a ball, a Bosu ball, small ball, child ball, or you can use a couple of pillows to put it between your legs. So here we go. I'm going to come down here in the hook line position. I have a band. You can either use a cable system or a band. You're going to come over, have it diagonally this way. I'm going to squeeze the ball. My arms are right here. My core is tight. And I'm going to pull it down and into my opposite knee to work the obliques, because the obliques work in oblique fashion. So to actually straighten them, you have to move in that direction. So core is tight, you're going to lift up and over, hold, squeeze the ball, hold for a couple seconds, come back down. And you can do this 3 sets of 10. Ooh, I'm shaking, this is hard. 3 sets of 10, and do that until you get tired. And again, don't forget to do the other side. Over here, squeeze the ball, tighten the core, bring it down and in and hold it there. Good. And do that 3 sets of 10 on that side as well, holding about 5 to 10 seconds if you like. All right, that's 2 slings. Third sling. Third sling is the longitudinal sling. Longitudinal sling goes from the peroneal muscles, the muscle on the outside of your legs, up through the hamstring, your biceps femoris, goes through this ligament you can't see right here because his butt's in the way, but the sacrotuberous ligament, and then goes straight up to the erector spinae. So it kind of comes in this cross, that was a nasty sound, comes from this cross all the way down. So it's a very long X to stabilize the sacroiliac joint. So exercise for this one, planks. Everyone hates planks, but they're very, very good. So side planks will get this sling. So we're gonna come down, elbow underneath the shoulder, feet, knees, hips, elbow, shoulder, all in one line. You're gonna tighten your core, keep your head right in here and lift up and hold this right here, keeping your core tight. So it's working on my back and all the muscles down below for that sling, the longitudinal sling. Okay, so you can hold that for about a minute or so. However long you can, do a couple of reps, maybe 3 to 5 on each side, till you get really tired. And I'm already tired. Okay, so next one. The fourth and last one is your lateral sling. Your lateral sling is the ones on the side. It's your lateral side. And it goes from you can't really see in this picture, but your TFL, your tensor fasciae latiae, TFL, this one right here, and the gluteus medius on the side kind of go up, and with the lateral muscles on the side too of the thorax, they kind of allow a sling just right in this direction here to help you stand on one leg, and again, support the sacroiliac joint. So I'm just gonna do it right here. So the exercise for this one, you've already seen if you've been following our Facebook Lives. Is the PGM hip heights. So this one, facing forward, hip against the wall, keeping your core tight. You're gonna elevate your wall leg up just a smidge, and that's gonna activate my muscles right in here. Make sure, a lot of people rotate with this, so you wanna make sure you keep your hips straight forward so you're not compensating, because I could stand here all day because I'm not working anything. So make sure this hip is up, hips are straight, looking straight ahead, and weight is in this heel, and you can really feel your gluteus medius, hopefully not so much the TFL, and a little bit of your back muscles, and this is your lateral sling. To make it harder, you can bring your leg up a little more and push your knee into the wall, and that feels great. So you can hold that about a minute or so, or again, till you get tired, do about 3 to 5 reps on each side. So those are the slings. In summary, posterior sling, anterior sling, you got your longitudinal sling and your lateral sling, all to help support the sacroiliac joint. So if you have any pain over there or any questions, you can give us a call, schedule an appointment with us, or maybe a virtual visit that we're gonna have up. So thank you so much. See you later.